Apparently you like a test, so we have another little one for you here today. Now this is a simple test you can do almost anywhere, just need a wall, hence why I'm so close to it. And this is a test to see if we have optimal pelvic positioning. Now specifically, this is not a hip hike, but what we're checking is whether you have an excessive anterior or forward tilt or posterior tilt, or if it's optimal. So why? Well, if you have an excessive tilt in either direction, it's going to put more stress on other structures. So, for instance, an anterior tilt will throw your center of gravity forward and can put pressure on the hips, knees, and ankles, but also your upper back as well. Posterior tilt, so this is where you've almost have a flat lower back. Now, we should have a natural curve of the lower spine or the lumbar spine. That's to add stress, strength and integrity to the spine. Now, if you lose that curvature, you put the spine at more risk of injury. So, what are the causes? Several. So, an anterior tilt could be that you have weak abdominals. It could be that your quads and hip flexors are tight because they attach to the pelvis and they pull you forwards. It could be tight back muscles, which attach to your sacrum and pelvis, and they tighten up and they throw you forwards. It can be weak glutes and hamstrings, so we're not giving you that support. Our posterior tilt could be tight hamstrings, could be alternatively the other way. It could be weak quads and hip flexors or tight abdominals. So there's several different causes, and this video doesn't actually tell you what the causes are. It tells you the potential causes, and then you know if someone says yes, you've got this, or you see today with the test that you have a posterior or anterior tilt, then you can go away and get tested and see what those causes might actually be and do something about it. And it can be simply a certain stretch or a certain strength. So here's what we do. So you need to find a decent wall. Now, preferably barefoot and bare top, but I won't put you through that. Now, you want to stand against the wall with your heels as close to the wall as possible. Yes, there might be a skirt in, but get as close to the skirt as you can. Then your bum, or buttocks, your shoulder blades, and your head should be against the wall. Now, that might be difficult enough for you to do anyway without checking for the tilts. So I'll lift up my top for this. So what we should be able to do is get our hand so it stops. When we slide it between the wall and your back, you should be able to get it through till about your knuckles and top of your hand here. Now, if you've got an excessive tilt, you'll have a larger gap and your hand will just go through. If you have a posterior tilt, you won't even get the fingers through. So it's a very, very simple test to see what that is. And so have a go at that. Let me know in the comments or messages and what you found. And if you have any issues, let me know, and maybe you can say, well, try this stretch or try this strengthening exercise. But a 2-minute test you can do at home, and let's take it from there.